Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about they did it again. And this is in JAMA, the Journal of the American Medical Association. I don't get it. I don't understand. We should be making things clearer, not confusing the issue and setting people up for arguing. So this is another one on long COVID study in children, and they looked for, it goes by different names, but they looked for post-COVID conditions after 90 days, probably a reasonable thing to talk about. And let me be clear, I have always said that these things occur. They always have after viral illnesses. This isn't anything new with COVID. It's not coming out of the woodwork, completely unusual for, and if a child's been hospitalized, there's going to be some challenges. And it doesn't mean that they don't recover, it just means it's going to be challenging. So when all the press has put out on this, and the findings were that 5.8% of the kids who went to the hospital, to the emergency department, were diagnosed with, that had post-COVID conditions. 5.8%, holy crap. And if those children ended up hospitalized, it was 9.8%. Like, that's a lot. 5.8% of children doesn't mean that they had COVID. So, that's a pretty clear thing that we need to let people know. So, in reality, there were people who didn't have COVID, or children who didn't have COVID had post-COVID conditions. Damn it, why are we not putting this up on the front end? Instead, we put out the 5.8 number. The real number is the difference between kids who had COVID and kids who didn't was 1.6% in the non-hospitalized kids. It was 5.2% in the hospitalized kids. The title should say 1.6% of kids who presented to the emergency room, they were sick enough to go to the emergency room, had symptoms 90 days later. We need to be clear on this. It's pissing me off, and this is JAMA. They should have that on the front end, and not, if you run a search for this, you're going to find that 5.8% of kids who have long COVID, and it's not true. It's really hard to find how many kids or people present to the ER for COVID versus stay at home. I have no idea. If I was going to make a guess, let's say, 5% or 10%, maybe it's 2% of people that are sick enough with COVID to present to the emergency department. That means that 1.6% of those people, if we look at the entire number, let's say it's 1 million kids who have COVID, and only 10% of them, so 100,000 present to, that's too high, 10,000 present to the emergency room out of 1 million kids, and of that 10,000, 1.6% or 160 end up with conditions 90 days later. That's 1.6 out of 1 million. Did I use 1 million? Anyway, it's a really small number. Math was never my strong point. Interestingly enough, this data came out of Costa Rica, Spain, the US, and Canada. Those numbers, the likelihood of a child, still same children, same physiology, same COVID, it was much lower in Costa Rica and Spain, 61% higher likelihood in Canada, and they used the US as so clearly, kids aren't different, but the environment we have surrounding that, and maybe the parents' impression of it, is higher. I'll post a link to this particular study in the description, but we just need to be honest in the findings section, which is all that forget the public, it's all a lot of doctors read. So if you hear that it's 5.8%, it's not. It's 1.6% of kids with COVID who were sick enough to present to the emergency department. So, off my soapbox, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.